I'm Yair Saperstein, the CEO of avoMD. What we're building is the next generation of clinical guidelines and pathways, but really what we're building is the way that physicians and clinicians can access evidence-based medicine at the point of care. So take a physician that's caring for a patient on the floors and they sent off an arterial blood gas. A lab can assess the acid-base level and some other lab values for the patient. And then they happen to be dealing with another patient, and the lab values come back. They need to review and understand what's the next steps that they need to do with this first patient. So they can just step aside, pull out their phone, get the lab data populated into their phone for ABG interpretation, have an understanding of what it means and the next steps to do, where they're still making their own clinical decisions, but they have right there the guidance of what to do. Then suddenly they move on to the next patient. Next patient has asthma and they want to go through an asthma severity calculator. They just pull up the calculator, plug in the values, or whatever values are already within the EHR get automatically plugged in, and they suddenly have access to, okay, this patient has moderate asthma, here's the next steps that I need to do based on this severity score. I think we're at the cusp of really accelerating our growth. We just closed a $3 million round. We hired a new technical product manager, so we're really expanding our staff, expanding our reach, bringing in more hospital systems, and it's an exciting time. We're looking for hospital systems who want to take their local-based, evidence-based medicine and really get it into the hands of all of their providers, and also see how are their providers using it. And we can provide that and get some feedback from them. So we're looking for really a partner who can continue to do this with us. Yeah, there's been a lot of positive feedback thus far. Hospital systems and urgent cares that we've been working with are really excited about what we're doing and have been connecting us with yet other hospital systems and with other urgent cares. And so, both continuing to use it and referring really speaks highly. And then also the physician users really love it. And a lot of asked, how can we contribute more? How can we take part in this? Because they really believe in it. I think medicine is getting to where it should be in the 21st century, but we're really helping bring it to that point. And so, right now there's these disparate systems of, the EHR where there's the patient data that already exists, but it's impossible to consume that as quickly as you want to. There's what the patient is telling you, which is the most important thing to understand, but within the context of everything else. And then there's what the hospital wants you to do, or what the societies are guiding us to do as physicians. And so really the aim is to have all the information together so that I, as a clinician, can make the best judgments of clinical decisions of what to do for my patient there and really guide. And so the vision really is to incorporate all of this information into one virtual clinical assistant that can really guide at that point of care and allow for more efficient care with a reduced cost in a way that improves outcomes. And so that's really what we're doing. I think COVID allowed everyone to realize that the way that we can reach others doesn't have to be in person, but can also be through technology means. And so, having virtual meetings and being able to connect in that way really brought medicine up, that telehealth is something which is real. And besides for that, there's really the adoption of technological solutions and the importance of interoperability and for these solutions to speak to and with each other. And so for us, where we're really building a tech solution for evidence-based medicine to be easily updated and distributed, we found that within COVID, a lot of people were more willing to adopt this kind of solution.